Hello, I'm Mark Davis. Welcome to the March 9th edition of Tuesday News Review, your timely source of news that is important to IDA providers in our community. March is Developmental Disabilities Awareness Month, a time to raise awareness about the inclusion of people with developmental disabilities in all areas of community life, as well as awareness to the barriers that people with disabilities still face in connecting to the communities in which they live. The Pennsylvania state budget hearings in the House Appropriation Committee concluded this week. That included the testimony of Secretary Miller of the Department of Human Services. The next federal COVID-19 relief package, the American Rescue Plan of 2021, passed the Senate on Saturday, 50-49, as Republican Dan Sullivan of Alaska was absent because he was in Alaska for a family funeral. It is expected to pass the House and to be signed by President Biden this week. The act provides state and local government relief totaling $13.114 billion for Pennsylvania, with $7.349 billion for the state and the remainder for local governments. We are awaiting specifics on when this funding needs to be spent. The act also includes a higher enhanced FMAP specifically geared towards HCBS of 10%, and in Pennsylvania this includes aging and IDA. The time period for which that will be paid is April 1st, 2021 to March 31st of 2022. If you haven't already, please reach out to Senator Bob Casey to thank him for his leadership on the inclusion of the HCBS bump. It has been through Senator Casey's and your tireless advocacy that this was accomplished. Other provisions of the act that we're tracking include the following: subsidizing and expanding COVID-19 testing and contact tracing by about a total of $96 billion, providing about $16 billion for vaccine distribution and supply chains. Striking minimum wage from the package, direct stimulus payments of $1,400 per qualifying person, extending unemployment compensation, including a $300 supplemental benefit, a 100% subsidy of COBRA health insurance premiums so unemployed workers can remain on their employer health care plans through the end of September, continuing the eviction and foreclosure moratoriums, increasing the child tax credit to $3,000 for children aged 6 to 17 and $3,600 for children under 6, while making that fully refundable. Please continue to share our message with Governor Wolf's office and state legislators that providers have struggled for years with significant underfunding and are now being hit hard with a combination of lost revenue and increased costs due to the pandemic. As providers decide how to deal with the pandemic, we're asking you to contact these legislators and remind them to appropriate the state relief funding to IDA as we are battling to stay in business with rising costs for PPE, hazard pay, overtime, and sanitation. Please be clear to your state legislators that relief funding is desperately needed now so that providers are able to pay DSPs and other staff an adequate wage to ensure that individuals with IDA get the supports they need to stay healthy and safe during the pandemic. Thanks for tuning in to PAR TNR. Stay safe, everyone, and we'll see you next week. Thank you.